So if you enjoy this channel or you enjoy this content, if you could take the time to hit the like button or the sub button, it really would go a long way. Medical channels don't sort of comply with the normal YouTube monetization, and we really are dependent on people actually subscribing to our channels. So again, thanks so much for watching. If you could take that time to subscribe, that'd be great. So tonight's case is going to be a difficult one. It's something we run into quite a lot in family practice and in medicine in general. So we're going to say a 45-year-old woman comes into family practice quite frustrated because she's tried for a long time to lose weight and she's been absolutely unsuccessful. So she's 5 foot 5 inches in height and she's 180 pounds. And ideally, she'd like to see herself in sort of 150 pounds, and she's tried everything she can think of. And despite, exercise changes, dietary changes, she's still not being successful. So she wants to know what the problem is. Does she have an underlying condition that's causing this to happen? And what can she do to fix it? So this is going to be something you run into quite a bit. And you're going to have some facility with talking, about what potentially could be causing this in the first place. So when we look at, weight changes and what is an actual healthy weight, how do we determine that? And what systems do we have available to determine that? So essentially, the most basic one is looking at what we call the body mass index. So this has actually been around since about the 1800s. So not much has changed in 200 years. And this looks at calculating the weight in kilograms divided by your height in meters squared. And essentially that gives us a number. And if that number is less than 18.5, you're considered undernourished. Excuse me, between 18.5 and 24.9, you're considered healthy. If you're greater than 25 to 29.9, you're considered overweight. And if it's greater than 30, you're actually obese. And if you actually did that calculation for this patient, 5'5", 180, which seems heavy, but you don't think terribly, heavy, that's actually obese. She would actually have a BMI of 30, and why this is clinically significant. So the BMI is not a fantastic test. There are certainly limitations to it. Obviously, it's not factoring into any muscle mass in the equation or fat percentage. And those two are important to distinguish between. People always talk about muscle being, heavier than fat. What we look at is density, and muscle is actually 18% more dense than fat is. But essentially, we want to be looking at this parameter, sort of saying, could it be better? Could we look at something that's more accurate? And oddly enough, there are some new measurements that are being taken that are actually more accurate than that. And why that's critically important, they did a study, I think in 2016 in the United States, and they did a large number of BMIs. They essentially looked at the majority of the population, and they found that for 75 million people, the BMI was inaccurate, which is pretty terrible. Shortly after that time, they calculated a new way of looking at the BMI, and that looked at multiplying the weight in kilograms by 1.3 and then dividing it by the height in meters by 2.5. And essentially what that did, it gave us a more accurate number, where in the past where just short people were actually seen as thin and tall people as heavy, it sort of offset to a certain degree. But are there other methods that we can be looking at? And there certainly are. You can certainly look at the waist circumference as you compare it to the height. And generally we want the waist circumference to be less than half of the actual height. And the more that parameter is changed in that sort of progression, the better it would be specifically regarding health parameters. And more lately, they've been looking at the assessment of percent body fat. And these ones have become actually quite useful. In terms of a grading system, when you look at males, 2 to 5% body fat is necessary for function. So they consider healthy between 2% and 24%. And if you're over 25%, you're considered obese. And in women, 10 to 13% is necessary for general homeostasis. So they consider healthy between 10 to 31%. And if you're over 32%, they consider that obese. And there's various ways by which you can actually measure body fat percentage, and some of them are very specific. Multiple compartment models are the most accurate. And then you can break those down into DEXA scans, which is dual energy X-ray absorptiometry scans. You can look at air displacement plethysmography, which is pretty accurate. You can look at hydrostatic weighing, which is where you immerse yourself in water. There's a number of different methods by which you can measure it, but at the end result, you're going to get yourself a number that's going to tell you whether your patients are, obese to a certain level, overweight, et cetera, et cetera. And a lot of times, while you may seem that on its surface that's critically important, you can have an idea just by looking. It's really not that critical to at least be having the conversation about, are we healthy? Are we moving in the right direction? So once you establish that, and you can tell her something objective regarding, yeah, I think we are, north of where we want to be. We then have to have a conversation about, how we burn calories. What is it? What is metabolism? What is basal metabolic rate? How does that pertain to what we eat, and so on and so forth. And for the sake of discussion, your metabolism is the process by which the body takes calories and oxygen and converts them into the energy source that we need to function as a human being. And that really looks at things like breathing and digestion and maintaining body temperature. And the things that affect that are like your age and your sex and your height and your weight, your muscle mass percentage, your fat percentage, as well as certain hormonal conditions, as well as certain medical conditions. And those are the factors that you have to be looking at that might be directly affecting metabolism. And now within populations, you can also have people who have a high metabolic rate, a high metabolism, and a low metabolism. And similarly, and we'll get to BMR in a second, a high BMR and a low BMR. And those individuals, so if you have a high metabolism, you burn more calories at rest. And if you have a low metabolism, you're actually more efficient and you burn less calories at rest. And you would think, listening to this, that what you really want is a high metabolism, because then you wouldn't be fat. But when you actually look at studies, a really high percentage of people who are obese actually have a fast metabolism. And so that makes you pause and realize that the cause for this probably isn't metabolic. And that's what most of the studies actually show out. It's not your metabolism that's the problem. It's usually calories that we're taking in. So how do we determine that level of calories that we should be taking in, and how therefore to lose weight? And this is something I've always compared it to my friends to, like the game of poker for me. If you consider poker is very simple. There's only a certain amount of hands, and once you know those hands, you essentially know the game. But as you start to play the game, you realize there's all kinds of different nuanced ways to play, to reading people, understanding who's bluffing, etc., etc. And dietary approaches are similar from that perspective. The actual concept is very simple. Essentially, what we look at is your total daily energy expenditure, which essentially is your basal metabolic rate plus the energy it requires to break down food, plus your actual energy required to move around. And whatever that number is, if you have fewer calories than that you're ingesting, you lose weight. And if you have more calories than that, you gain weight. All stop. So extremely simple. So why is this so complex? And we'll get to that in a minute, because we all struggle with this. So essentially, if I'm going to figure out the total daily energy expenditure, I'm going to have to be able to figure out somebody's BMR, or their basal metabolic rate. And what is your basal metabolic rate? That's actually the percent of calories, or the number of calories that you actually need to run your body while at rest. And that actually takes up 60 to 70% of the calories that you utilize on a daily basis. When you look at energy utilized to move around, that generally, and these are averages, represents about 20 to 25% of the actual calories that you expend during the day. And then only up to 10% is the energy required to actually break down food products. So when you look at that, you realize that foods in and of themselves are a minority of the actual energy you actually expend. So then you start to look at that and sort of say, well, how come I'm not losing weight then? And a lot of people will jump to the concept that it must be because they have an underlying medical condition. And I don't blame them and I don't judge them, and it's certainly important to make sure you're not missing those. But to put that in context, consider the percentage of people who are obese and overweight, and then we're going to consider medical conditions that may affect those. So when you look at numbers in North America, the percentages of men who are overweight is about 1 in 3, or 33%, I shouldn't say overweight, who are obese. 33% are obese. And when you look at percentage of men who are overweight, it's actually all the way up to 70%, which is just astounding. And then when you look at women, they do better than we do. About 1 in 4 women are obese, and about just shy of 60% are overweight. So when you look at that numbers and then consider, well, how many of those are related to an underlying medical condition? So if I look at the most common one that actually cause weight fluctuations, that would be hypothyroidism. And the incidence of hypothyroidism is 1 in 1,000 in males and about 18 in 1,000 in females. So you can see there's a massive discrepancy there, because if I look at that by percentage, if I look at males, 0.1% are due to hypothyroidism, and yet 70% of males are at least overweight. So the vast majority of people who are overweight, it's not because of an underlying medical condition. Similarly, if I look at other conditions, Cushing's syndrome could cause us to be overweight. What's the incidence of Cushing's syndrome? About 10 to 15 per million. What if I look at Gaucher's disease? Gaucher's disease, about 1 in 40,000 people have it. Unless you're an Ashkenazi Jew, in which case it's about 1 in 500. And that poor population, those Ashkenazi Jews, get affected by everything. I feel so badly for them. In medicine, you run into that again and again. But that's a topic for another discussion. And then there's things like Tay-Sachs disease and other conditions. Wilson's disease is another one. It's a copper metabolism problem. Wilson's disease, about 1 in 30,000 people have that. So clearly, what's causing obesity, the vast majority are not these underlying medical conditions. And you can also have hormonal conditions which will contribute to that and certainly make it harder for us, the biggest one in females being PCOS or polycystic ovary syndrome, but not impossible. We can still get on top of that, but it does make it harder. So clearly we have to be somehow getting to the bottom of what's going on from the standpoint of the dietary changes that we have and causing this to happen. And are there such foods that can actually slow and actually speed up metabolism? And this is something that's out there right now. I get fairly frustrated by it because there's kind of a misconception that's out there. Because when you consider the fact that only 10% of our energy goes towards breaking down food, you realize right off the hop that that's not the majority. More importantly, when you look at the thermogenic effect of foods, or essentially what that is how much energy it takes to break down foods, when we look at the macronutrients, the most thermogenically active by far is actually proteins. Proteins require 10 to 30% of the energy they produce to actually break themselves down. Carbohydrates, it's 5 to 10%. And then when you look at fats, it's only 0 to 3% to actually break them down. So a lot of these programs will stipulate that fats, are directly affecting metabolism, or technically what they call metabolism killers, but they really don't affect metabolism to any great extent. They're affecting total daily energy expenditure, but not actually metabolism. And on top of which, when you start to consider how much energy is produced by these macronutrients. So again, when you break down a gram of protein, you get 4 calories. When you break down a gram of carbohydrates, you get 4 calories. But when you break down a gram of fat, you get 9 calories. So when you consider how little energy it takes to break down fats and how much energy they actually produce, you start to realize that that might be part of the problem that we actually are looking at. So how do we fix that specifically? If we now have a number for BMR, the easiest way to calculate your basal metabolic rate is to actually do calculations, and there's a whole bunch of different ones. The most efficient ways, though, is what we call direct and indirect calorimetry. Those are really specific, and you have to be in a room and they monitor how you're breathing and perspiring, and a lot of very specific tests that really only happens when you're doing studies and those type of things. Otherwise, they use specific equations for it, and there's lots of different ones. Nowadays, you can just go online and get one of those equations, which is a lot simpler. And once you have that value, you'll then multiply it by some activity multiplier. So most studies will look at BMR multiplied by about 1.2 to 1.9 to get a specific number that will be then your total daily energy uptake. However, the one I find the most simple, and I've used this for my patients, I essentially take your weight in pounds, and if you don't exercise at all, I multiply that by 13. If you exercise 2 to 3 times a day, I multiply that by 15. And if you exercise about 4 to 5 times a day, I multiply that by 18. And that'll give me my total daily energy expenditure. The other thing you can do as well is just assume that for males, it'll be about 2,500 calories, and for average females, about 2,000. And you can adjust that up and down. And the reason why this part is not critical is because once you realize that essentially you're just going to now be adjusting your diet by about 100 calories a week until you start to lose weight, what you start out, it's not really all that critical. So whether we're at 2,500 or 2,400 calories, it's more about how well we're going to monitor it that's going to prove whether we're effective or not. And when we look at, food specifically that may affect metabolism, and I should mention this just because there are a couple of them, what I need you to be aware of, though, is that that effect is extremely minuscule. So if I look on the positive factor, are there foods that actually cause you to increase your metabolism? The 3 ones we mainly look at are chili peppers. They produce something called capsaicin. In a normal meal, you never get enough for actually to affect your metabolism at all. You'd have to have tons more and it would barely affect it. Similarly, caffeine is something that can affect it minusculely, but if you have enough caffeine to have an impact, you have the negative effects of caffeine, which aren't wanted. And then the one that there is some interesting studies about is actually green tea. There's a chemical in green tea called EGCG. And if you actually have about 3 glasses of green tea a day, about 100 mils in each glass, you can burn 100 to 200 calories. So that may be actually significant. And on the flip side, there are a couple foods that slow the total daily energy expenditure or increase it, and those are something you want to take. Those are usually like processed foods or white sugar, white flour, those type of things, so you don't have massive amounts, but it boils down more specifically to the calories that are embedded in those than anything else. So after I've said all that, it would seem to you that this seems relatively simple. We just have to find that specific number, our total daily energy expenditure, and eat less calories than that, and we should be absolutely fine. So how come we fail? How come this poor woman is sitting in front of me and she's struggling so much? And I would tell you there's 4 reasons that I've identified in the course of being at this for 25, 30 years. And you have to be addressing them directly. The first and foremost one, and I don't mean this lightly, the reality is that life is very, very hard. And by that, I mean that we all struggle to a certain extent. We can lose jobs. We can have partners that, cause stress for us. We can have children who make bad decisions. We ourselves can make bad decisions. We don't sleep well. We don't exercise as much as we can. And all of that will create poor hormones and mainly bad choices when it comes to actually meals. And that comes back to hurt us. And the body doesn't care if you've been good for 3, 4, 5 days in a row. If you have 2,000-3,000 extra calories on day 6 or 7, overall, you're just not going to do well and you're going to continually put on weight. The second reason that I think we actually lose weight is because we have trouble losing weight, is because we sort of indirectly, we fool ourselves. And I'll preface that by some examples that I brought here. But what I mean by that specifically is the people who will be successful is the ones who are really sort of anal about this, make their general calculation, but then they really track the foods that they're eating and the amounts that they're eating. But examples of what I mean by this is I'm going to show you the following examples. This is a muffin. And so this muffin here has about 110 calories in it. This is also a muffin. But this muffin has about 360 calories in it. So if I'm rigid about my program, I'll factor that in. But most of us will just consider one of these a muffin, and you can see the problem that creates. Another example I'll give you is if I look at donuts. So this is a donut that's about 60 calories. And obviously 2 of them are about 120 calories. But this is also a donut. This is 120 calories. This is about 220 calories. And this donut is about 330 to 340 calories. So if we're allowed to have a donut in whatever dietary program we're having, or we have a calculation for a donut that says 100 calories and we eat one of those, we're just fooling ourselves. And then finally, I'll give you a cookie example. So if we look at cookies, this very common cookie that we can all recognize, that's about 70 to 80 calories. This cookie is about 90 to 100 calories. This, also a chocolate chip cookie, is about 220 calories. This lovely chocolate cookie with some caramel in it is about 300 calories. And this one, which is an Oreo-based cookie that has a mushroom in it, this is just shy of 400 calories. So again, all of these are obviously cookies, but if I'm eating this cookie and I'm going to consider in my head that it's equivalent to calories in this cookie, then again, I'm just fooling myself. And this is why the numbers don't add up and I actually gain weight. Another factor that really causes people trouble is if they actually eat out a lot. And this is similar to these examples. When you're eating out, you're not as aware of how many calories are in foods. And so you can very easily have a high caloric content. And the reason why foods when we eat out taste so good is because a lot of them are dipped in heavy butter loads. They have tons of actual chemicals on them. And that's what we enjoy. And that's why they taste so lovely. But the calorie component to those can be 2, 3, 4, or 5 times what we would normally have with that type of meal at home. And that can really come back to bite us. And finally, the last one that I think you have to be considering with your patients is that most of us don't know what it is to exercise. So again, in all of these calculations, an intrinsic part to that is figuring out how active you are. And people will say, oh, I exercise 3 times a week, and then they'll make that calculation. But as an example, I ran into this about 4 or 5 years ago, I had a patient who we were talking about this type of thing, and I was talking to her about how her exercise was going. And she said to me that she hasn't been exercising since my brother was off work. Now, my brother is a chiropractor. He was very good at what he did. And at first I thought it was because she must have been having an injury, and because she couldn't see my brother, she wasn't exercising. But when I asked her more directly, what she meant is that when she saw my brother, she considered that her exercise. Now that, you can understand, is pretty ridiculous. If anything, it might have been a little bit of exercise for my brother, but it was clearly no exercise for her. But she was not trying to be cute. She honestly felt that that was exercise. Similarly, when I actually ask people pointed questions, I find a lot of them find that sweating is gross. And if you find sweating is gross and you don't do it when you exercise, you're clearly not exercising, and that is going to cause problems. So because of those 4 conditions, this is why weight loss is so difficult. And as a primary care physician, you have to be very patient in taking your patients and helping them realize where we can win, where we can change things, and the type of stuff we have to do more of and less of to potentially have a winning situation that sets us up to get into a healthier lifestyle in general. So I know that that's a lot to digest. This is a really complex topic, and I hope that it's not too many details to hold on to. We'll come back to this again in other topics, but this is something you should sort of assimilate as best you can and start to utilize this as you talk to your patients. But if I can give you no advice, just be as patient as possible and try not to be judgmental while still holding people accountable as best you can. All right? You have a good evening.